New information tonight shows the spread of COVID-19 on the Downtown Eastside has increased dramatically. As CTV's Alyssa Tebow reports, that's raising serious questions and concerns about the best way to distribute a vaccine to a vulnerable population.
On the streets, in the elements, and at high risk of exposure to COVID-19.
We're very concerned about the Downtown Eastside.
Dr. Brian Conway is president of the Vancouver Infectious Diseases Centre. Every week, his team tests a small number of people for signs of the virus.
Over the summer and perhaps even into the early fall, we were picking up 10% of the population that was being sampled having antibodies. In early December, as many as 40 to 50% are now showing antibodies. So the disease has a big footprint in the inner city.
Latest figures from the CDC show there's been 953 cases in the small health region that includes the Downtown Eastside, meaning more than 1% of the population has tested positive. But Dr. Conway says many people living here don't get medical help, and the results of his small sample indicate just how much COVID-19 has spread.
There's a high proportion that appear to have been exposed to COVID at some point during the pandemic.
High-risk individuals living in shelters are listed in the first priority groups to receive the vaccine. A rollout Dr. Conway fears will come with challenges.
The plans have to be drawn up as we speak.
We're very happy that our community is among one of the first priority groups.
Jeremy Hunker works with the Union Gospel Mission, one of the organisations stretched during the pandemic. This year, there's been a 70% increase in the number of people being turned away from the shelter after hitting capacity. He's welcoming news of a vaccine rollout.
We don't know what, when, how, where. We don't have that information, though we trust that the health authority is working on that and has a game plan.
The rollout is expected to happen through February and March. Alyssa Tebow, CTV News, Vancouver.